Good morning, everybody. Sorry I can't be there today. As I said in my message, I twisted my hip last night and it was quite painful, to put it mildly. So I am not going to try to drive into campus and walk across campus to class today. So I'm recording this just briefly to give you a bit more in-depth information about the knowledge application process that we're talking about today and that you're working on, and then I will uh, open up an informal, optional Zoom um, office hours this afternoon during our regular class time from 3 until 4:15. Um, in case any of you have any questions and want to come and talk about your project and whether it's the knowledge application part or some other part of your project. So just a reminder that the knowledge communication one pagers are due this afternoon or this evening. And then the knowledge application one pagers are due on Monday evening. And in class on Monday, what I'd like you to do is to make a 4-minute presentation. So very short about your knowledge system. And so just on one slide, reintroduce us again to your project. And then on the second slide, uh, you know, you could do a 2x2 matrix and have 4 boxes and just your knowledge generation, your knowledge validation, your knowledge communication, your knowledge application. Just give us a very quick overview again of how that works. No more than 4-minute presentations. I'll put that part also in an announcement so that you have it. Anyways, knowledge application. Again, thinking of ourselves as knowledge analysts and knowledge managers. Application, well, I'll say that later. Never mind. I was going to say application is the most important part, and I'll explain what I mean by that here in a minute. I mean, you might think, okay, we've done generation, validation, communication, and all that stuff is important, right? Because it's where the knowledge comes from and how it gets to people. But of course, application is what we do with the knowledge. It's how we use it. And so in that sense, it is the purpose of a knowledge system is to make knowledge that can be used effectively, used successfully, used credibly, to enable us to do things in the world, to make decisions, to take action. And so that's what we're talking about here today. It is the fourth function of a knowledge system, or the fourth functional element of a knowledge system, if you prefer to think about it that way, right? And it's the set of ways within the knowledge system, the activities, the practices, uh, through which the knowledge that's generated by the system gets used, whether in making decisions, taking action, or in some other way to make a change in the world, right? And so, um, it's that relationship between what happens in the world as a result of the knowledge and the knowledge system, and the knowledge system itself, right? So the system, the knowledge that it's generating, but then the relationship between that and what happens in the world, right? When we take action. And I'll give you an example here in a minute to kind of work through this a little bit more. That's what we're talking about, right? That it can be very short, it can be extended in duration and time, right? But that use of the knowledge, right? So, if we're, uh, in our apartment getting ready to go out in the morning, I know we don't do this in Arizona, but, you look at the weather app it says it's going to rain today, you stop in the closet and pick up the umbrella. That's stopping at the closet and picking up the umbrella, right? That's the use of the knowledge, the action in the world, the change in the world that happens as a result of that knowledge, right? Um, so, I think as with all of the different functional elements in the knowledge system, when we think about analyzing knowledge application and beginning to unpack it, right? What's going on in this particular example or this particular case? It's useful to start with a few questions, right? One is, what are the core knowledge contents that are being used or applied? I mean, we've recognized that knowledge systems generate sometimes enormous amounts of data and information. And when we're looking at the knowledge application function, we often strip away lots of that data and information, filter it out, and get down to the nub of the problem, right? That particular piece of the knowledge that we're actually going to use. I think if you just think about that weather app again, we rarely use anything like the sum total of the knowledge that's in that weather app. If you start exploring what all is in this weather app, I mean, you find all kinds of stuff in the weather app. In fact, I could really go through it right now and start to go in and really unpack and unbundle and do a bunch of things. And there's a wind map, there's a rainfall map, there's the daily 24-hour temperatures and cloudiness and rainfall. Rarely do I use all of that. There's an air quality map, index map. I have looked at the air quality index map once or twice in the last 5 years, right? So, we don't use all the information that's in a knowledge system. And so the question for the knowledge analyst is to really get in and look and see what's actually being used, which knowledge is actually being used by whom, right? So what is that core knowledge that's being used or applied? When and how is that knowledge application occurring, and who's doing that work of using that knowledge in that particular way? And of course, I think of myself as a user of a weather app, but there are, there are probably many, many, many other people in the world using the weather app, sorry. And so, what are they doing? That knowledge, are they doing the same things that I am with it? I don't know. These days I find myself mostly looking at it to find out what the temperature is outside in the late afternoon, because I want to know whether I have to go, upstairs and open the door to the upstairs to allow for the outside air to flow in, or do I need to come in and shut everything up and turn the air conditioner on, because at some point, it gets hot up there upstairs in the afternoon, and so I need to do it right. And so I just look at the weather app. I was like, is it 75? Is it 80? Is it 95? Like it was yesterday, right? In that late afternoon, and kind of think about that particular piece, right? So start with these, right? What are the core knowledge contents that are being used? When and how is that knowledge application occurring? And who's doing that work to use the knowledge? I'm thinking about Jacob's NASA project. NASA has this database of all the things that have gone wrong with previous NASA missions, right? So who are the people that are actually using that knowledge? What are they using that knowledge? When are they using that knowledge? And what exactly are they taking away from that database? Right? This can help you as a knowledge analyst think about, is your knowledge system producing too much information that's getting in people's way? Right? Is the core of the knowledge something that they're, something specific in there that you can really, strip away some of that extraneous knowledge, really make it more focused, right? Or by contrast, when they're making that decision, when they're taking that action, do they have all the knowledge available to them that they think they need? Or are they constantly asking themselves at that moment, how come I don't know this? How come I don't know that? Right? That's an opportunity again to, improve your knowledge system by opening up, by producing some additional information and delivering it to the decision maker at the time. So I just want to walk through a simple example here. We haven't really talked about medicine as a knowledge system, but of course it is. And that knowledge system as practiced is interesting because it has two different sets of knowledge generation, knowledge validation, and knowledge communication embedded within it, right? So if you think about a doctor and the patient interacting in the doctor's office, the patient has come in, they're coughing, they have a fever, right? And so the doctor is going, okay, what's wrong here, right? And so that's the knowledge application and use context. When the doctor is trying to figure out what's going on with this patient, call that diagnosis. They're trying to make a medical diagnosis. And then, of course, subsequently, they're trying to make a treatment. Needless to say, this comes to mind because, yeah, I had to see the doctor yesterday because I busted up my hip. Excuse me. So, on the one hand, right, you have medical research, which has been going on for centuries, and medical experience, right? And so doctors have been treating patients, and scientists have been studying the human body and human health. And those two sets of activities have generated an enormous amount of information and data and insights into the ways in which things go wrong with the human body. So you have this generalized medical knowledge of human ailments, and we could talk about the knowledge generation process and the knowledge validation process and the knowledge communication process, right? But at some point, all of that information ends up in the doctor's head, right? And in resources that the doctor has access to, medical books, medical journals, medical databases, etc. Right? And so that's one nub of this medical knowledge system. And the other, of course, is it's great to know all that stuff, but you also have to find out what's going on with the patient, right? And so when the patient comes into the office, the first thing that happens is the usually not the doctor, usually a nurse or some other orderly in the setting, whether it's the office or the hospital, wherever you are, takes your vitals, right? So these days they measure your blood oxygen level, they measure your blood pressure, they measure your temperature, they ask you if you have a fever. They ask you, to that's called taking your vitals, right? And it's just a data collection exercise, a very standardized data collection exercise that's designed to tell them things about you. And then the doctor comes in and the doctor says, so tell me what's going on. right? And you start to tell a story. And then there's a question and answer period where the doctor asks you certain kinds of things, and, as in this picture, or in my case, it's a physical injury or an ailment, then the doctor will ask you to do various sorts of things. I had to stand on one leg, I had to stand on the other leg, I had to stand up, I had to sit down, I had to twist left, I had to twist right, right, and then the doctor, pressed on various parts of my hip and my back to see which parts of them hurt, right? And all of this is a Q&A period, right? And then if that doesn't do it, the doctor might order tests, right? So in my case, for various reasons, they ordered an X-ray, and so I had to go and sit and get an X-ray taken, and then that X-ray gave them a bit of a picture inside, which they then folded into that diagnosis, right? Or they might do a test that you send away for, right? They might take a blood sample, send the blood to the lab to be analyzed, right? All of that part of the knowledge system, which is guided by the doctor's generalized medical knowledge, but all of that other part of the knowledge system, right? That's knowledge generation, that's knowledge validation, and it's knowledge communication. That's all happening in real time as the doctor tries to figure out you and what's going on with your health and your body, right? So that's the second piece. And then the application part in this context is the bringing of those two knowledge domains together, right? The doctor says, well, these are the kinds of things that happen to hips in abstract. And these are the things that, Clark Miller is experiencing this afternoon. And if I bring those two together, then I think what's happened, and she gave this name, joint, some bizarre name, but she thinks I sprained a joint, and it's the joint between my hip and the bones that run along your spinal cord, right? And so those two join up at the base of the spine, and there's a joint there that bends, and she thinks I sprained that joint. So that's the diagnosis. That is, in this case, the first decision. In this case, it's the doctor making a decision, right, based on the application of the generalized medical knowledge that I have, plus the specific knowledge that I have from you as a patient. I'm going to diagnose you as having this joint sprain. And then there's a second decision, which is, what do you do about it? So she gave me a shot of a anti-inflammatory, anti-pain medication. There's another decision, which is, are there additional longer-term treatments? So I have a prescription for some slightly stronger than Advil, slightly stronger than Advil pain medication, which she gave me, and then there's some directions about what else I need to do, follow up with my primary care physician, and so forth and so on. So there's a set of decisions that get made by the doctor. Of course, there's also a set of decisions going on around this knowledge system that I'm making as well. So I'm getting knowledge from the doctor about what's happened to me, why it happened, and what I should be doing to take care of it and get better over time. Right. So that's all part of that application too, right? And so in this case, it's a fairly complicated application process, right? It's not just the information comes in, like if you're flying a fighter aircraft, don't ask me why this is coming to mind. I'm thinking of Top Gun, the movie, right? You're flying a fighter aircraft, you make a decision to pull the trigger, right? I mean, you see the visuals around you, you make a decision and it's done, right? In this case, it's medicine, it's often much more complicated to do that application process. And indeed, with various kinds of ailments, you see the doctor many times, and the doctor continues to collect information, continues to do tests, continues to ask you questions, continues to observe what's happening to you and to your body, and make additional follow-up decisions and actions, right? And so in this case, knowledge generation and knowledge application get quite fused together as you go through the process of having some sort of a health issue, right? So that's an example of knowledge application and knowledge use. I even had a picture of this, right? So the specific knowledge coming in, the generalized knowledge coming in, the diagnosis, the matching up with symptoms with the generalized knowledge. So when you're thinking about knowledge application or knowledge use, as we've been doing for each of the others, it's a list of questions that you can ask about that context. Questions like who is involved in the application of the knowledge? What are they doing? Where and when and how does this knowledge use or application take place? What is the decision or action that the knowledge is getting used to inform? And what happens as a result of that decision or action being taken? And how does the decision and what happens, the outcome, relate to the knowledge itself, right? So what is that link, right? And then as we think about our knowledge system definitions, right, we had a bunch of epistemic elements, right? Contents, uncertainties, epistemologies, ontologies. How do those things influence the way that the knowledge gets used, right? So, an obvious example in the case of medicine, right, is that the doctor doesn't start off the conversation with much in the way of understanding. I mean, maybe if it's a doctor that I've seen many times before, they have some knowledge of my history, some knowledge of who I am. But in this case, it was an urgent care doctor. I'd never met this person before, right? And so, lots of uncertainty about the specifics of my particular case. And so, and so she was trying to feel around, right? So she had some information like, what are the drugs that I take on a regular basis? And so she was trying to think about, are there relationships between the kinds of drugs that I take and what happened to me, and did she need to ask questions about any of those things, right? That was all uncertainty, right? And of course, she's probing that uncertainty, trying to resolve it as she's asking me questions and so forth, right? Of course, the epistemology, right, the methods of the knowledge system shape which knowledge we get. And so we get knowledge of a certain kind as opposed to knowledge of another kind, right? And so that can influence the decision because, of course, we only have the knowledge that's available to us when we make the decision. And so we can, if you use, so if the doctor is thinking about a portfolio of tests that they could do, just in this particular instance, they could have taken an X-ray. They could have done nothing. They could have taken an X-ray, or they could have taken an MRI, right? Put you in a big machine and get a look inside. Or they could have done an ultrasound, which is another, more portable tool, more like an X-ray that can be done fairly quickly, right? But all these things have costs. And all of these things potentially generate information, right? So each has a methodology, an epistemology, an ontology attached to it, each of these, right? Just talking to me She can get certain kind of information. What hurts? What can I do? What can I not do? She can observe all that from the outside, but it doesn't get her inside, right? So the epistemology and ontology of talking to me doesn't give her a window on what's going on inside the hip, right? The X-ray gives her information, a picture of what's going on inside the hip, but it's of certain kinds of things, right? It's the hard stuff. The bones show up really, really well in X-rays, but other things don't, right? Um, Ultrasounds are much better at giving you a picture of the soft tissues. So that the tissue that makes up the joint is more of a soft tissue, and so it might show up better on an ultrasound. Um, MRIs give you the most detailed picture of all of the stuff that's inside, and it's in, the ultrasound and the X-ray are like two-dimensional pictures, and your body's a three-dimensional object, right? So the MRI actually gives you a three-dimensional picture through that area, but it's an extremely or much more expensive process, right? And so the doctor's saying, do I need to do that? Of course, the insurance company is going to ask, did we really need that test to be done? And so there was a, and so it was a trade-off, and she ended up doing an X-ray, but not either of the other kinds of things that could have been done, right? Um, what are the organisms? We also have a set of structural elements, right? The people, the organization, the practices. What are those? Who's involved in this knowledge system? Well, the doctor, but also the nurses that took my vitals were involved. The patient, in this case, is involved. You say, well, yeah, of course the patient is involved, right? But the patient adduces certain kinds of uncertainties, right? Um, some patients know what's going on around them, others, maybe less so, right? Um, Language, right? You might have a patient that speaks a different language than the doctor, and then the healthcare system has to find a translator, and then you'll have to worry about do pieces of knowledge get lost in translation, right? So people matter to this particular knowledge system, right? And then practices, right? What are those routine practices? Obviously collecting vitals gets done every time you see the doctor, but also, the practices that the doctor develops over time to get better and better at getting good information out of you as a patient, right? As I was saying, right, is knowledge application use a one-time event, or does it occur in a distributed fashion over time in which you continue to learn things and evolve the decision the way you have a complicated, I mean, you may see the doctor once if you have a cold or the flu and they give you some medicine for it and it gets better and you go away. But on the other hand, if you have an ongoing medical condition, you may see the doctor many times over many years for that same condition in which they're, evolving their diagnosis and their treatment to try to help you out. um, and a final one, I think, think about those people who are making use of the knowledge, making decisions on the basis of the knowledge. Are they being trained? I mean, obviously, in this case, right, doctors have to go through enormous training to be able to use generalized medical knowledge effectively, to be able to interact with patients effectively and get the information that they need to make a good diagnosis, to know what all the tests are available to them, to know when those tests are appropriate or inappropriate, to know how to read the results of those tests, use that to inform their decision, right? All of that involves extensive training, right? 3 years of medical school, constant going to seminars, reading, learning, what's going on in the latest field. You get a patient with a complex issue going on with their health that you're not familiar with. You go and you read about it, right? You learn what other doctors have already learned about that particular subject matter, right? All right. So, come back where I started. The application of the knowledge in a knowledge system, the use of that knowledge is the most important part of a knowledge system. It's what its purpose is. As I said here, it's where the rubber meets the road, right? And it's where knowledge failures happen. It's not necessarily where the cause of the knowledge failure is. And we'll learn a lot about that when we get to the sessions on knowledge failures and we begin to look in more detail at particular examples of that, right? So the reason that a knowledge failure occurs is quite likely somewhere else. But this is where that impact happens. This is where the wrong decision gets made, the wrong action gets taken because the system isn't performing the way that it's supposed to be performing. And so even if you're convinced that the moment of application is not where the failure is being caused, right? This is why we talk about these as systems, right? Because there's upstream things that happen that are the ultimate cause of what's happening downstream with the failure. But if we don't know what that failure is, if we can't understand the context of knowledge application and knowledge use, the knowledge contents that are being used at that moment, the ways that that's connecting to the epistemology, to the ontology, to the people, to the organization, right? All of those connections to that knowledge application are how we begin to diagnose what upstream is going wrong that contributes to that knowledge failure, and what is it that we need to work on that will make the knowledge system better at delivering the outcomes of the decisions and the action, right? That's what we want. We want the patient to be diagnosed correctly, to get a correct treatment, and to get back to a healthy condition, right? That's the goal of the knowledge system, is that outcome, that healthy outcome of the patient. And so understanding that knowledge application moment is critical for diagnosing then our diagnosis as knowledge analysts. What's wrong with the knowledge system? Why didn't we get to that outcome of a healthy patient? So thank you. Good to see you, so to speak, virtually this morning. I will put this video up on Canvas for you to watch. And then, as I say, this afternoon, optional office hours for anybody who wants to come and chat on Zoom with me about your project. All right. We will see you all on Monday for your presentation.